Hey Dan, this is value video number 6. Leaky gut 6. Natural treatments also helps inflammatory bowel diseases. That's the title. Hi everyone, I'm Dr. Gary Smith of the Toledo Family Wellness Center. Today I will explain 4 strategies that must be done to remedy leaky gut and inflammatory bowel diseases. Part 1. We need a doctor trained in the natural remedies who does the correct testing to show extent or stage of damage, which of the many causative factors are present. Well, those tests must include Cyrex labs to find the extent. Also, you need some testing of the IgG, immune responses, for food and environmental sensitivities, tests to find pathogenic gut bugs, tests for insulin, sugar, cortisol levels. Lastly, the brain and spinal nerves controlling the gut function must be tested. That may surprise you, but many people can be helped by spinal manipulation and exercises of the brain and nervous system to improve the brainstem function, which controls much of the digestive processes. One example of this in my own practice has been a former college football player who became 90% improved by only me manipulating his spine. Part 2. You must eliminate offending substances. That means the foods, the chemicals, the heavy metals, pathogenic organisms like the bacteria, yeast, viruses, parasites. We also eliminate dysfunction of the nervous system, regulating the digestive system. For example, the motility of the intestine and the status of the immune system in the intestinal lining is determined greatly by the nervous system. Therefore, that's how management of the nervous system will improve your gut function and your healing. Part 3. Provide the right good organisms and the right amount of them, which will help heal and eliminate pathogenic organisms in the gut. Part 4. Once you know the extent and the layers of gut damage, you must provide nutrients to effectively heal the lining and improve the immune system functions. Today I'll review parts on a later video. No, just a minute here. Today I'll review, let me see, parts. Oh man, this is messed up.
Trying to find your notes.
Just a minute, let me see, what did I mean to say? Be done. Well, I'm not even going to talk about that. I just can't. I don't have time. Okay, so a couple of parts of these items that I had listed, 1 through 4, we're going to discuss. I'll review part 1. To remove the foods that are damaging your unique gut lining, you need the correct test, which is my leaky gut, which in my leaky gut videos, number 7 and 8, we'll discuss further for you. Then you must remain dedicated to keeping those foods out of your diet for at least 2 months. Then start adding back one of the foods every 4 days. make sure that in that time you don't have any responses or adverse responses to the food that you have been taking, and that you can tolerate it well. You want to be able to take that food that you're testing for 4 days in a row. Okay. And then you go on to the next food. If the food does not pass, you may retry the food again 6 months later. And if not, then chances are that the immune tolerances will not be able to be returned. Regarding pathogenic organisms, it is a good idea to test which bacteria, parasites, yeasts that you have. For ridding yourself of parasites, I use 1 teaspoon to 1/2 cup of water drank with a meal of diatomaceous earth. It is safe, fine powder that is like glass chips to parasites. Regarding yeast, you may need a drug called nystatin, but the natural remedies are often very good, and those would include supplementation with berberine, yerba, mansa, oregano extract, and undecyclic acid. Also, caprylic acid is useful because it will dissolve the cell membrane under the cell wall of these yeasts. I use Saccharomyces boulardii, a beneficial yeast, to grow in the intestine and to crowd out the bad yeast. Candida, for example, being a bad yeast. If there is an overgrowth of harmful bacteria, you know what? Dan, could you check me a second here?
Sure.
I'm going to be reading, and you tell me where my eyes are. Do I look like I'm reading? Over there.
No.
I don't?
No, it's good.
I look okay?
Yeah.
You sure?
Yep.
Okay.
I'd tell you if you weren't.
All right, good. Right, we don't want to do that.
Looking good.
Okay. If there is an overgrowth of harmful bacteria, there always is, if there is an overgrowth of harmful bacteria, and there almost always is, I recommend a good probiotic. As an example of that strategy, it must be 1 to 12 different strains, including things like Rhamnosus, L. sporanges, DDS-1, Acidophilus. Also, a good prebiotic, which is a substance promoting more good bacteria. It's like good bacteria food. Should have a couple of grams of arabinogalactan. Good prebiotic foods are onions, garlic, artichoke, asparagus, chicory, leeks, mushrooms, Yacon powder, that's a sweetener or syrup, which is a nice. Next. You need to eat 1 or 2 of these prebiotic foods every day. And it's important to prevent most of the good bacteria dying in the stomach. Okay. Acid, wait a minute, just a minute, that's wrong. Something happened here. 7, 8. Just a minute, what the heck happened here?
Mm-hmm.
Yeah? Okay. It almost seems like I'm missing a page here or something. Yeah, anyways. Okay, we're going to move on. 7. Okay, you need. Okay. The prebiotics are important to stop good bacteria from dying from lack of good food. Also, it's important that these good bacteria have a stabilizer in the supplement that will help protect the good bacteria when they're in the stomach. So you want to be looking for that when you're purchasing a supplement. Take 50 to 100 billion per day of the good bacteria. Another great all-around pathogenic organism is overall, I'm going to repeat myself. Another great all-around pathogenic organism killer is a high concentration of colloidal silver of 6 to 1,000 parts per million. The typical varieties at the health food stores only has about 10 to 100 of those parts per million, and is quite expensive. I have a homemade remedy of 6 to 100, and you may be able to find them on the internet also. And I have patients on this for 2 months when I do that because of the life cycle of these pests. The other thing is I recommend that you take about 2 ounces of the silver, 1 to 2 ounces of that silver per day during this process. But it's an excellent bad bug killer. Okay, the stomach function is also crucial to having a good, healthy intestine function. A functional need, repeat that. A foundational need is to get stomach acid high enough for 3 things: to start the breakdown of the food. People with GERD and acid reflux often do not have enough hydrochloric acid, but too much lactic acid in their stomach. So these people need a special program to remedy that, which is another discussion of mine, possibly some other time. We need to destroy the pathogenic organisms so they don't enter the intestines. And number 3, the acid levels need to be strong enough to trigger the stomach to expel its contents in about 30 minutes after the meal. There's a reflex. When the acidity gets high enough, then the stomach will expel its contents. And if the acid level does not stay or does not reach a high enough level, then that reflex won't happen and the food will sit in there. So this 30-minute expelling of the food does not usually occur in GERD and acid reflux conditions. In general, you want to use lifestyle, diet, and effective supplements to remedy this situation. To help stomach get acid enough, take 1 to 2 hydrochloric acid tablets with your meals up to tolerance. To destroy unknown pathogenic organisms in the stomach, take 1 to 2 ounces of the 600 parts per million colloidal silver. And you can also take berberine or oregano extract. Very good for the stomach and for the bugs of the intestines also. To help heal ulcers, the highest potency and quality aloe vera should be used. I recommend Aloe Pro by what's called PRL Labs. I recommend that this be taken every time you feel acid pain and at least 1 ounce 4 times a day. This will coat it and provide nutrients for the healing. Well, folks, this topic I have briefly summarized is more complex and needing modification based upon individual needs. I hope this helps you. My next video, number 7, explains some of the tests that you need to do that are seldom done. Until next time, yours in health, Dr. Smith. Bye. Okay.